Hello, I'm going to be presenting our poster entitled Patient Perceptions of Retinal Detachment Management and Recovery Through Social Media, Identifying Underserved Areas. So, in background for this presentation, retinal detachments are really an urgent surgical problem that a lot of people don't know about. And if there's not awareness about it, they can really actually seek medical care when it's way too late and they can become blind. They also require a lot of difficult post operative recovery. And risk factors for retinal detachments are people who have or nearsighted or have thin retinas, and often they don't know until they get symptoms very late or even have a detachment without any symptoms until it's too late. People who have retinal detachments actually seek support from social media groups. And these social media support groups really provide accessibility to advice and support in topics that could cause anxiety and confusion, such as retinal detachment repair, particularly in underserved areas or countries or areas where there's really a lot less access to care. In Boston, often there are a lot of specialists around, but in many areas there really are not there's not enough specialists to really provide good care for this very specialized area, and the people can go blind. So we really sought to determine how topics related to retinal detachment repair could be supported through various social media support groups, since social media just expands everywhere. Our methods is that we used an observational study of the largest Facebook support group, which had almost 8,500 members, and we looked at the data in 2021 from March to July. Comments were coded by content such as pre-procedural, peri-procedural, post-procedural, or repeat procedures, and participant response such as emotional responses, likes, comments, asking for medical advice, and misinformation. And engagement was analyzed by looking at the total number of responses and reactions to the comment. We did a very detailed analysis of these comments in the support group using chi-square tests and linear regression for the different types of posts. And we worked with retinal specialists to really categorize these appropriately using statistical analysis software. We looked at 416 posts from actually 14,797 comments from almost 3,500 active members. Interestingly, by country, while there were many in the United States, there was a really high proportion of members from India, Pakistan, and Bangladesh, where there is really a very low income area and hardly any access to the appropriate retinal specialist. Sometimes they have to travel really far to see the right doctors, and delay causes blindness. These are some sample representative comments that you can see how frustrated patients are when they don't know what to do. They're nervous, they're scared, they're going to lose their vision. And you can see that they had retinal detachments, they're feeling emotional and devastated. Sometimes they've had to have multiple procedures, and they really just seek out support from these social media support groups. Some of them also have issues with their child, and really these are some of the representative comments that we saw. This figure shows the type of context with respect to surgical procedure as we categorize them. So the type of posts based on procedure. And you can see there are a lot of different prevalence of posts based on whether it's a repeat procedure, pre or post surgery, or some other type of time. And you can see that a lot of the time, these are people seeking advice, really asking questions, expressing frustration and anxiety. And what we found is that 60% of misinformation really occurred in often pre-surgery topics versus some post-procedure process or non-procedure post. So a lot of the misinformation is related around the surgery. And there were a lot of negative emotional responses, really more commonly expressed in reference to repeat procedures. If somebody needs to have another surgery, and some of them needed so many, they were very, very frustrated. This is a table that kind of analyzes the post characteristics by procedure category. And we had three main categories, which is misinformation, asking medical questions, negative comments, and asking for medical advice. And what we found from these data is that posts asking medical advice were really associated with the most engagement by number of comments, a lot more comments in regards to that. And this is a social media group which often does not have any access to the retinal specialists because there's very few of them and they're very busy and usually not on social media. So this is seeking medical advice in a social media platform. And there are also negative emotional responses that appeared very commonly in multiple repeat procedures. And they did have some positive emotional responses as well. People felt relieved if they could see again or the procedure worked well. So in discussion, there was really a lot of negative responses, particularly after there was a need for repeat surgery. That really made people frustrated. And asking for medical advice really generated a lot of comments, likes, most engagement. And that is a challenge because social media is really a lot of people just seeking support. It's almost kind of like blind leading the blind because they don't have medical expertise to really give them the proper medical advice, and you can have bad outcomes where people become blind. We also found that there was a high proportion of people seeking these social media groups in underserved areas where there's really very limited access to healthcare. We saw some comments where people would be hours and hours away from the right medical care or not having enough access. And so that's why they sought these social media groups. So in conclusion, we found that social media is really a widespread platform. It really is used worldwide for a lot of non-physician, non-retinal specialist-based support. And that can lead to a lot of dissemination of really misinformation, really false information, and could have bad outcomes. And this really suggests the need for heightened awareness in physician-guided counseling. Often the visits they're busy and they don't give enough support to the patients, and so they seek these social media groups. This work really highlights the global effects of social media and that there should be efforts to really address these underserved areas where there's less access to care. And this is some links to a nonprofit organization that has stemmed from awareness from this work to really link retinal physicians asking and answering frequently asked questions and really linking with all of these widespread use of people seeking help from social media groups. And those are the links, smirkinc.org, and there's also an Instagram link as well. And even on Facebook, if you type in social media improving retinal care, you'll find that as well. So thank you so much for your time.
Thank you so much for that amazing presentation. I'm just looking over here to see if we have any questions. I don't see any questions right now, but I'm really happy that you shared the link to your organization in case folks could reach out to you. Would that be all right if they reached out to you?
Yes, absolutely. There's a link to be able to send questions and comments and take a look at the link as well. It's also on the profile here. And when you have time, take a look at the poster. And if you have any questions, there's probably a way, maybe there's a way for us to engage and interact. But it's really a problem that a lot of people don't know, and people go blind. They don't realize it, and then they have a detachment, and it's too late, and they can't get to the doctor for hours.
Well, I think it's you've really highlighted an issue that a lot of folks don't know about, that is really disparately impacting certain populations and needs to be addressed. So I can't thank you enough for sharing your work with us today. And again, if we have any questions, we'll get them out to you. And some folks
Okay.
are really congratulating you on your great presentation.
Oh,
So
thank you.
thanks. So
Yeah, I hope
yeah.
people will have more awareness. It's more common than you think. And the website also talks about risk factors, things like being nearsighted, which who isn't nearsighted?
Oh,
So
yes.
yes, people wearing glasses who have thin retinas. So I hope that
Yes.
it's got people to have more awareness of the problem.
Well, wonderful. And so just
So
one
how do we
final.
do I go out and there's some questions here? Can I reply on the chat to some of
Oh,
these?
by all means.
And then I can go to another booth as well, right? We can kind of.
Yes. By all and and I must congratulate you. You are our first streaming presenter on the new
Oh,
platform. So
great. And then I
congratulations.
can just move out, right?
Mhm.
Okay, great.
Yeah.
I'll try to answer some of the chat here and then
Okay.
I'll go look at the others. Thank you so much. This was really fun.
Thank you. So I'm going to stop broadcasting here and you
Okay.
can answer your questions. Thank
Okay.
you.
Thank